Welcome everybody to our third, I think it's our third Kroc seminar series event of the semester. We are really happy to have Rebeca, Cazares, Adame with us today, who's, I think, this is not the first time, I don't think, that an IPJ staff member has presented at these. Is this right? I don't know. But anyway, hopefully it'll become a much more regular thing, and because we have such an amazing pool of talent at the IPJ, and so anytime we can showcase them and create an interactive environment for the students to take advantage of their expertise is amazing. And Rebeca is somebody who has been doing work in the Tijuana fronteriza region for a while. Like I didn't want to like out you, right? But like a while, and she's a medical doctor, and she comes to us from a healthcare background and continues to do work, as you'll hear, with that sort of perhaps like public health mentality in mind, bringing that to our work in these studies. Yeah, so we're delighted to have her. Thank you so much for being here, and I'll just be quiet and let you do your thing.
Thank you. Thank you so much for the introduction and for having me here today. So today I want to talk about a peer-reviewed study that came out this year. They co-authored with some colleagues of mine from Touro University, Dr. Sahai Burrows, Sarah Sullivan, Josie Hunt, and Grace Han. This study the intention was to understand how organizations that are providing services at the border on both sides of the border are doing after all the turmoil from all different sides. So from immigration policies that are constantly shifting, COVID-19, changes in funding, the funding landscape. So I want to talk about some of the key findings, what are some of the challenges that still persist. This was, the data was collected between 2022 and 2023, but we still have some of those challenges. And then I want to take some of those lessons and reflect on how that is maybe some useful lessons that we can learn, whether you're planning on working for an NGO, for public policy, peace building, et cetera, and hopefully we can have this. So to get us started, a little bit of the context. Why is this study relevant? As we all know, migration is one of the most pressing humanitarian challenges today. There have been 281 people displaced in 2022. That's 3.6% of the global population. The OIM mentioned, I think it was a couple of years ago around this time, that the US-Mexico border became the deadliest migration route by land. So it's important to understand how the people who are providing sometimes life-saving services for people who are migrating through these routes are doing it. The US-Mexico border reflects global migration dynamics on a local state. People in shelters in Tijuana will always joke around that sometimes they don't even need to look at the news. Whoever nationality is coming through their doors, they know they're gonna hear something about it in the news just a few days later. So this happened with migrants that came from Haiti, from Central America, from Ukraine, even before news broke out about the war in Russia and Ukraine. They started getting people in Tijuana shelters, so they knew that something was going on. So it's important to know people who are on the ground have very extensive experience on what's going on with this landscape. Humanitarian response often is fragmented, so a lot of these gaps are left to organizations like community-based organizations, faith-based organizations that provide, like I mentioned, sometimes life-saving services. And this study asks, how do they do it amid such volatility? The main research questions were, how do migrant-serving organizations sustain operations under instability? what internal and external factors foster organizational resilience, and what lessons can be drawn for practitioners and peace builders. So just as part of the context, the organizational resilience framework that was used was a public health one, but it's based on the capacity to prepare and effectively respond to crisis, reorganizing if necessary, and drawing on lessons learned while maintaining and strengthening core functions. This also encompasses not only how to sustain those changes and how to adapt to them, but sometimes even how to capitalize from some of the hardship to make that organization stronger. Three of the main themes, or three of the main pillars of organizational resilience is anticipating the threats and planning for them prior to a crisis whenever possible, coping with unexpected events by implementing solutions for specific problems during a crisis, and adapting after a crisis by learning and developing new capacities. As we'll see in some of the key findings, anticipating has been one of the most, or was one of the most difficult things to achieve for these organizations, since the constantly shifting landscape made it very difficult for them to know what to expect, and it still does. A little bit on the methods. Around 30 people were interviewed from these migrant-serving organizations and staff across US and Mexico. This was for the qualitative portion of the study. There was an online cross-border survey assessing resilience capacities. We used a benchmark tool for to measure resilience. It was a validated, an already validated tool, both in English and Spanish. And 150 people were asked to complete the survey. From these, 30 people were asked if or agreed to participate in the interview. Like I mentioned, this data was collected from May 2022 to February 2023. Did a thematic analysis integrating qualitative and quantitative insights, triangulating what we find in the qualitative data, the cross-border survey, and the benchmark tool. And we did a comparative focus, shared and divergence resilience pathways were analyzed. Some of the most salient sample characteristics was that most of the organizations had been operating for 10 years or less. The majority of them had been around for about that decade. Geographic distribution, we did it all along the US-Mexico border, the 6 Mexican states and all of the American ones, but most of them were from Baja California, Arizona, Texas. 36% were from the rest of the border. Most of these organizations were in the healthcare sector, including mental health, or either provided housing, legal aid, and 30% provided food services. A lot of them were a mix of. Most of our respondents were male, and most of them were in a managerial or leadership position. As I mentioned, we used a benchmark resilience tool. Of note, adaptive capacity and total score, the adaptive capacity was 5.3% out of 8. And the total score for all of the organizations, the mean score was 8.4 out of 13. When tested for reliability, these two did a little better than planning capacity. But this scored a mean of 3.1 out of 5. It's also important to note that there was really no difference between the Mexican and the US organizations. They both scored about the same. The benchmark tool uses a Likert scale, but we dichotomize the results to rank them between highest and lowest, or strongly agree, strongly disagree, and these are the ones that are most notable. Almost all of them, or the majority of them agreed that the managers and their organization led by example, that they build relationships with other organizations, they're mindful of potential crises, and that they have a good sense of teamwork. However, the items that scored the lowest had to do with planning and how well the people in these organizations thought that they either had enough resources, both financial and just planning. It's in case of an emergency, if they knew what to do, or if they had enough people that knew how to act in case of an emergency, or that they had enough information on how to proceed or respond. I'm not gonna go through all of the table, but one of the interesting things from this table was on the side of the organization, impact of external threats. It's interesting to know that both on all sides, either for changing policies, COVID-19 or changing migrants, these three are the challenges that we were looking at, and these are some of the items regarding external crisis and their impact. But funny enough, the ability to raise funds did not rank as something that was negatively impacted during this time. And part of the reason was that a lot of our participants mentioned that people wanted to help out from different fronts, especially during COVID-19. There was a surge in funding, both local, state, federal, and a lot of private donors also that wanted to be involved and provide more funding for these organizations during this time. However, a lot of this funding was also lost shortly after this time period. But both for the policies and COVID, most organizations, both on the US and Mexico side, saw at least a little bit of a surge during this time, because there were just people that wanted to help mitigate the crisis. As far as the qualitative portion of this study, the main interview themes were the impact of threats, coping strategies, and constraints and facilitators. Some of the sub-themes that came up when it comes to impact of threats, what were the demands of services, safety, both related to the people who provided the services and for the people who received them. Difficulty planning, like I mentioned, it was just difficult to know how many people were coming, what they needed. The demographics of the people that were in shelters, for instance, changed a lot, and so the needs also changed quite dramatically. There was definitely a lot of mention of burnout, coping strategies. We had both internal adaptations and external. I'll go through them in a little bit. And some constraints and facilitators were, like I mentioned, resources, institutionalization, how this affected how they were able to cope, and collective conscience was also important. So when it comes to demand for services, one of the things that was mentioned the most was how policies like MPP, the Remain in Mexico policy, and Title 42 created this bottleneck where there were suddenly so many more people just stuck at the border waiting to be able to cross, and how this largely affected what they did and what they expected to be able to provide. So for instance, if before there was the standard, short-term housing, health services, food, clothes, etc., they would stay for maybe a week and then move on. This went on for weeks and weeks or months sometimes. So the type of services they provided, the amount of supplies and resources they needed was completely different than what they saw before. And this was on both sides of the border. On the US side, what was curious is that some of the US organizations started getting a lot more funding, for instance, during COVID. But then they couldn't get the resources either to Mexico if they were partnering with someone in Mexico, or they were expecting more people in the US and they just didn't show up because people were just stuck on the Mexican side. Safety-wise, the number of deaths, like I mentioned, increased exponentially, both from people using unsafer routes trying to get to the US, the border getting higher. So both policy and just actual number of people trying to cross just increase, and the number of people that were unsafe was definitely increased. There was also, there is still the threat of organized crime targeting migrants, organized crime targeting migrant-serving organizations as well. So some of the staff also mentioned that they felt unsafe during this time, especially on the eastern part of the border around Tamaulipas. Some organizations actually had to shut down because of safety concerns during this time. I mentioned there was just simply difficulty planning, trying to figure out when people would show up, what they would need, how long they would be able to stay, and just the length of and the type of services was also unpredictable. Disrupt across border activities. A lot of these organizations work in collaboration or started to during this time. And when the border crossed, it was just impossible to get supplies. The number of volunteers, I remember in my organization during 2018, 2019, we had so many US volunteers, volunteers from Canada or other places that wanted to come and provide services during the migrant caravan from Central America came, and this just completely halted during 2020. We had binational programs running, supplies trying to come in, and everything just halted then. There's definitely a lot of burnout, but the most salient part about this is that staff in these organizations were not only dealing with being exposed to or vicarious trauma or being exposed to terrible things, but also going through a lot of personal hardship with families getting sick or themselves getting sick, or simply living at the border. You're always in touch with people who have a binational life and might be affected by migration policy. So burnout was more intense during this time, or still is. We haven't done a follow-up, but I know that for many of my colleagues who we interviewed or were working at these organizations at the time, many of them have quit or stepped down. The organizations thankfully are still going, but burnout was particularly harsh during this time. Some of the second theme were the coping strategies. So some of the good things that came out of this were internal adaptations, how organizations have to shift and change, not only to provide the services that they needed to, but also to take care of themselves and be able to keep going. So this participants, for instance, mentioned that they had to change their calendar to include self-care days, in addition to the official holidays. Things like Mother's Days, birthdays, anything that would help morale and give them a little bit more rest whenever possible. External adaptations, I think this was one of the most important ones, is just how much organizations had to work with each other and start to collaborate more with each other. When resources are so scarce and there's always some competition between them. And during this time, one of the positive things is that we saw a lot more collaboration between organizations, because there was just no way for one to do it all. And usually the organizations that try to do the most or to have just such a huge fan of services had the hardest time in bouncing back. So collaboration and expanding networks is what worked best. Also across the border, not only locally. The third theme were constraints and facilitators. So resources, a lot of organizations mentioned how the leanness of their organization was very important, just having that flexibility. Big organizations did a little bit worse than the leaner ones, just because they were able to ship what they were doing a little bit easier. And to take the resources that were coming in and just double down on what they were doing and be able to collaborate with other organizations better. As far as I'm sorry, I'm really bad at pronouncing that word, institutionalizations. A lot of organizations struggled with, especially the ones that have been around for a while, with the fact that they seem to be putting out fires over and over and over and not being able to shift to longer term planning or more sustainable practices. Instead, they were still focusing on what to tackle next, since so many changes were happening. So this participant said, we're trying to figure out how to turn our organization from this small nonprofit of desperately committed individuals who are providing these services to a creative emergency response type service, to a larger, more stable, more sustainable employing organization that's providing a long-term set for services, a variety of different services, and that can weather kind of changing storms of federal policy. So they already knew that this was a threat, and while they were still trying to become that sort of organization, they had to tackle all of these different challenges that just came on at the same time. So that, I would say, is still definitely a big challenge today. There was also a sense of collective conscience. This participant mentioned a lot of sort of common sense things like having stable funding don't work as well in this context. It does sort of speak to the strength and the grit and the resilience that comes from people who genuinely believe in what they're doing, and just that kind of conviction and willingness to dedicate years of very hard, painful work to serve our brothers and sisters. I remember this participant quite well because she had a background in business administration, and she had been doing this for a while. She had some experience in the corporate world, and she just flat out said, like, none of the stuff I learned in school is useful now. None of the planning, none of the organizational skills that I learned is really helping right now. It's really just about grit and resilience and having our leadership just, keep us going. She said that the culture had a lot to do with it. They were adopting, she said, we're like a Hispanic family-oriented style of a culture where they would sit more together to have lunch, to celebrate birthdays, and before it was more a corporate sort of model where you had 15 minutes to eat separately. Everyone did it in their cars and, just wanted to get the workout. But they forcibly had to change to something that seemed counterintuitive, but because they would have less time to do the work, but having them, relax a little bit, have that collective conscience or build that collective conscience, help them with the grit and how to sustain, because it was incredibly frustrating to do all the planning and then to have something just topple down that every week. So just kind of stayed with me. So just an overview of these findings: resilience among migrant-serving organizations is dynamic, collective, and adaptive. Cross-border collaboration enhances this flexibility. We saw a lot of people from US organizations who were able to cross the border because people from Mexico, we weren't able to go to the US like we did before to get supplies or to receive volunteers, for instance. But whoever could just, kept the work going, and a lot of that had to do with using both strengths. In the resilience tours and the items that we mentioned, the Mexican organizations scored higher in adaptability, and the US organizations scored higher in planning. So combining those was really fruitful during that. Leadership networks and learning drives resilience. Kay mentioned a lot of these folks that weren't on a managerial level spoke really highly of their leadership and just how much it meant that they believed in what they were doing. It was what, kept them going. Structural changes persist despite adaptability. So like I mentioned, some of these folks that we interviewed are gone, stepping down, or taking a break sometimes, but the organizations, many of these or the ones that were able to adapt remain. And it's funny because we also hear something similar when it comes to the people that receive the services that come and go, on just how important it is to for them to go to a place that has a certain reputation or the legacy of that organization, that they just know that they can go there. They come from all over the place and their route to the US. And they know which organizations or where they can go and feel safe. So building that takes a really long time. But for both the people who provide the services and for people who receive them, even though they're constantly changing, the structure that's built around and the like I mentioned, the reputation around the organization just received. To summarize again, some of the external stressors, we saw policy volatility and shifting enforcement priorities, unpredictable funding and donor fatigue as well. Like I said, there was this little surge during COVID and during the caravans, for instance, and in Title 42. But also at some point when things don't change, especially private donors cut back or stop giving. So diversifying funds, this also becomes a big lesson for a lot of these organizations. There's been a rise in demand in humanitarian caseloads. It's also something that they have to grapple with, and securing the stress for frontline workers for themselves, but also for the people they're providing services to. Some of the internal capacities for resilience were mission-driven leadership, fosters continuity. I mentioned this before. Learning culture enables innovation. One of the things that was really good to see in a way that organizations were able to collaborate, sometimes if it wasn't through resources or other types of things that they could provide, like referrals. There was a lot of training done between organizations, just being able to share knowledge, data, how things are done was very fruitful during this time, and it's something that keeps on going. Like I mentioned, diversifying funding was also a big lesson, and networks buffering against uncertainty. So there are networks that are still ongoing now, and of course some of these challenges are still there. So there's a shift of more integration focused models. There was also more collaboration with academic institutions, with some government entities. Not everyone wants to work with everyone all the time, but these integration focused models definitely increase resilience. Partnerships with government and academia, like I mentioned, tech use and coordination and data management. This has lately been a little bit more of a sore subject because of the question of the safety of the data and what people are using to have sometimes very sensitive information on hand. But simply things like more remote work was done during this time, and some of that just, was adopted and kept going. And finally, innovation as a survival in volatile environment. Some of the persistent challenges, I think we've all seen this, there's underfunding that limits planning, being able to know how many people will come to try to get these services, which policies will remain, which policies will change. It's just simply limits planning capacity. A lot of these organizations, for instance, on the US side that had that bump in funding, but weren't able to provide the services or just didn't, ended up kind of stuck with all of these supplies and space or projects, asking next year or next term for similar funding can be an issue. So that's one of the things that they had to grapple, how to ask for funding if you don't know what's coming. Burnout and turnover, reduced institutional memory. However, these organizations have been good at maintaining, that sense of, like I mentioned, collective conscience and just the policies and the ideals to being the same. If that's the case, then usually it makes for a good survival tool. Policy unpredictability, strains coordination, same as with funding, and fragmentation between US and Mexican actors is also just something to always contend with, but fortunately there was a pretty good coordination between the two, at least when it comes to migrant-serving organizations. So some of the strategies and lessons for practitioners were to invest in staff well-being and learning. That was definitely something that organizations kept mentioning. We didn't even think about, days just for mental health or to, provide these tools for our staff, and now they're just essential that they do. Strengthen cross-border and cross-sector networks. Like I said, organizations that are a little bit leaner, that have a certain focus in mind, but collaborate well with others, did better. Pursuing flexible funding mechanisms and engaging in advocacy to influence policy also collectively is definitely more fruitful than by themselves. And finally, some of the implications for peace building practices. Just to note that resilient migrant-serving organizations contribute to stability and cohesion. Adaptive work exemplifies everyday peace building and bridges research, policy, and practice. So it's to note that peace building doesn't happen just in international settings or armed conflict settings or in academic circles, but just in everyday work that people working on these organizations are doing. I think there are some pretty worthwhile lessons to be about. Just finally, resilience is a process of learning and adaptation. These organizations embody collaboration amid uncertainty, and the border realities demand sustained partnership. Thank you. Questions, comments, applications?
You said that like Mexico-based organizations scored better on adaptability, and then US-based scored better on planning. Was there other of these recommendations or of these takeaways, other kind of distinct differences you saw that partnership works is much more of a process in Mexico, or works better there, and in the US going together for fundraising works better? Is there any other kind of distinct things that you think were interesting to know across the two?
I think that was the most salient one. It was funny enough, for the rest of the items, they scored pretty similar. But in terms of, and this is a little bit more subjective, but in terms of the work culture, the US organizations invest more in sort of coming up with team building activities, but the ones in Mexico kind of did a little bit more just organically as part of the culture. They didn't name it like we do team building. They just did it normally. But that was, that was an important part on both of them that was strengthened during this time just because of the burnout. So I think the laying out, planning, naming was more clear cut in US organizations, and on Mexico's side, it was more like, what can we do with what we have? And let's just make it a little bit more fun or less stressful.
Did you find differences in terms of how people articulated secondary trauma and burnout between US and Mexican organizations? Not how they dealt with it, but how people actually were able to express what was going on.
Yes, I think so. I think just the concepts of trauma-informed care are probably been going on a little bit longer in the vernacular in the US and US organizations. But the exposure to it is is there on both sides, and on the Mexico side is around this time, I think it started to become more popular to use the words like psychological first aid, trauma-informed care, and also just collectively and providing self and collective self-care was also being introduced. However, a lot of these practices and terms were already known and common, but they were being called something else.
But on the Mexican side, the safety and security issue would be a bigger threat.
Yes, it depends on which side, which city. This was more most prominent. On the Tijuana side, even though there is a lot of the safety is definitely an issue, just the numbers and the fact that there are many more organizations and the spotlight is bigger there would make it slightly less unsafe than other places. But we still saw, leaders being threatened or people in shelters being targeted, shootings, that sort of thing. But just finding ways to combat that was also part of the lessons during this time.
Have the organizations that you spoke with seen the findings yet? And I'd be very curious if it was surprising to them, first of all, or useful, like sort of what does it look like to have this mirror back?
We did, and I think the thing that was most surprising was that they scored pretty similarly on both sides. That seemed to be kind of a shock that that their US counterparts did pretty similar on the scores. And yeah, like you mentioned, there are a lot of things that when we talk about it, it seems like we're discussing the same thing, but we might, name it something different.
How do these findings impact your thinking about sort of policy for IPJ and our partners like the Nonprofit Institute on campus? It seems like there's a lot of conclusions here that are of relevance, and keeping in mind sort of limited bandwidth. Do you see, for instance, the coalition building dimension is something where we could help, or continuing with the research dimension is another sort of area where we or the Nonprofit Institute could help out with some of these areas, or the policy advocacy dimension. There's a few different areas here Just curious how you see, like what sort of marching orders does this give us coming out of this? And maybe you can think about it also in terms of just like the impact on the Tijuana River Basin stuff you've been thinking about. Do these interface there in some way?
Yeah, absolutely. They all, I think it's important to look at the intersections and just try to grow the network as much as possible. If you grow that collective conscious of what the end goal is or what the goals are, but that each organization and each country has, very unique strengths that they can work well together, but it is a matter of sitting down, organizing, getting to know what they do. And the tricky part is always funding, competing for funding, being able to share knowledge, data, et cetera. But when it comes down to times like these with a crisis, that was kind of secondary. People would still, be open to what normally we would see, our other organization who was competing for the same grant, for instance, would share the link and say, we're all on the same boat. We're just trying to survive, and it doesn't matter if if it seems like we're doing the same thing twice, there's not enough. So let's just, band together. So understanding how other partners work, and yeah, doing a lot of introducing them to someone else who might help. Good networking and basic understanding of each other's strengths.
Do the partners in the network generally see USD as a proper convener in that sense? I mean, or is there somebody else in the network that's, more that people look to convene everybody?
I'm definitely working on making USD more visible in that light. But yeah, there have been other US organizations and institutions that have been in this for a while. One of them is UCSD, just because of their global health program, is very involved in work at the border. SDSU with the joint US-Mexico Center and studies that they do. But yeah, definitely want to get in there and be part of it. I think one of the things that US institutions also bring very importantly to the table locally is not only, knowledge and strengthening numbers, but we've had fellows say, I feel more secure, I feel more empowered to say what I need to say regarding a difficult subject like femicide, for instance, because I'm being backed up or because I'm being, voice amplified by a US organization. So that makes them feel a little bit more secured. And
I wonder if that also gives us a chance to provide some cover for doing other things that are perhaps like now frowned upon. I mean, like you had policy changes in here. Those policy changes seem to actually like increase the ability of these organizations to get funding according to your results. But I think that that's partly because like, if you're talking about 22, 23, you're talking about like Title 42, and you're talking about MPP, the Remain in Mexico protocols that are putting producing a larger problem for one. So we're not sure if like the increased funding going there is matching the problem, but there's also a lot of media coverage of this sort of thing, and the changing policies that we are now experiencing are, mega steroidal overdosing on like CBP and a huge sort of like a massive expulsion of people, and also a pulling back on, USAID, USAID is dismantled, government funding is going away, and NGOs are actually being, perhaps not explicitly threatened, but like are being warned off implicitly from filling in government funding gaps. And so like in some ways, I would imagine you won't see this sort of thing, like that same kind of boost that you saw here in this moment, and perhaps like I don't know, perhaps universities can play some other role, like they are doing this under this aegis, right? You know,
Yeah.
anyway.
Yeah, absolutely. And there's always been some of that too, and that's how they start working together. Like, there was a project research, et cetera, that, you know, that sparks that collaboration and it keeps going. But definitely, even though diversifying funding is important, it's definitely more challenging right now. And like I mentioned, shortly after this, a lot of that funding was cut or went away, especially the one related to relieving turmoil from COVID-19. And right now, a lot of the people who would probably be going down to the border or providing support or funding, on the US side also feel somewhat, you know, fearful of speaking out or being more visible when it comes to supporting anything that has to do with migration, LGBTQ rights. We you know the drill. So people are maybe less inclined to do that as well.
I'm thinking about emotional intelligence. So I know, sorry, in the presentation, you talked about collective conscience. And so I'm thinking about the planning and the adaptability, and those seem to go hand in hand. And it takes the emotional intelligence to realize, like, my plan isn't working, I need to adapt. And so what a great partnership. I'm thinking like a handshake, right? When those two come together, when those qualities come together. And you touched on this a little bit when you said the team building was more organic in Mexican organizations. And I'm going to dive deeper into that to figure out how to activate that emotional intelligence across all organizations, or because I think this is very transferable to any organization. Any organization needs to be more resilient, especially in our times. And so I'm curious if you could talk a little bit more about the organic work that you experience, that you witness, and I think recommendations that could flow back. And I'm biased to our organization because we're in Kroc, right? Like how do we learn what others are engaging in to help make our community stronger?
Yes. I think some of it is just cultural, and that's the way it's been, and you influence your group and your peers, but some of it is also just come from hardship and the need to do this sort of thing differently. We were pushed to do things differently, otherwise, it was just not going to work. And that's both for getting the work done, but also being able to keep the people who are doing the work, keep them going. So I think important thing is to not lose sight of that when things seem a little bit calmer, and just keep doing, what works. This is something different, but I wish, for instance, that we, in some cases, we would still be wearing masks, for instance, because that still takes care of people in public spaces, or so that what I'm trying to say that goes somewhat similar when it comes to the strategies that we're used during hard times to take care of ourselves and to take care of a team, to just keep doing them as a regular practice.
It's like this ethic of care.
Yeah.
For one another that blows up to the organization.
Yeah, that's a great way to put it.
You said it, I'm just reframing.
That's hard though, right? Because it is an ethic of care, but at the same time, it's difficult to then show people that you actually care, right? When you're like, yeah, it's like that people always were reporting like more emotional distance, even though you were trying to, right?
But I think it's just the habit or the practice of it, or when it becomes normalized or habitual, it's just what what you do, you don't really, at some point, you don't really question it anymore, and if it's working, because, turnout is less in certain organizations, or you'll see that they're there for the long haul because their practices in taking care of themselves and the work that they're doing are working, even though most of them earn very little money and don't, like,
Yeah.
it's not the incentive. You can see that part works, and I think there are some pretty good lessons there.
Other questions?
It's kind of like on the other side of that topic, but the burnout that leads to the turnover, that leads to the deterioration of the institutional memory. Well, how would they tackle that, right? Because people are leaving who were probably really good at their job, and then they leave and they have to find people who are just as committed to the work. So how did they tackle that? Or what did you see in terms of that?
I think mostly some of the baseline, just ethos of the organization always remains, but whenever there's a big shift, it's also, again, adapting, and just you can't have the new person just copy what the other person did. There was just a few months or a few weeks ago, one of our fellows who led organization for over 10 years, and she had a shelter for women and children in Tijuana. I mean, the organization is still going and they have new leadership right now, but I mean, she was she was completely spent, emotionally, but passing on the torch is also having to, come to terms with the fact that someone else is going to do the work differently, and that's a good thing as long as they're adapting. But some of the baseline is still there because people are still, getting services, coming there. And I think one of the most gratifying things is to hear people who come for the services, who've traveled really far or and don't have ties to the city, say, we've heard about this place all the way from, the southern border, and we knew where to come because our family members who already made it way to the US told us to come here, or they would be treated nicely, or they would be, so it's I think a lot of these organizations take that very seriously. Being able to keep that is really important to them.
That makes me think of, the work of James Marsh, this like organizational behavior sort of political scientist, and he did a lot of empirical work to look at turnover rates and sort of resiliency of organizations as a function of turnover rates in environments of volatility. And it's like, and it seems like there's oftentimes like a sort of optimal rate of turnover. If you have zero turnover and your environment is changing, your organization isn't learning anything new by bringing in new people who, know more about how the environment is functioning. Of course, if it's like too high, yeah, you like start to lose like the whole sense of why you're there and how you do things in the first place. I was just wondering, like, on that note, like, did you see any of these organizations trying to systematize learning from the migrants themselves, like employing the migrants themselves who might know better than themselves how to respond to migrant needs?
Oh yeah, absolutely. That's common practice in them to try to include people, and that's also a really big challenge because it's a moving population constantly. So training someone, having programs that can employ migrants or just be able to learn from them and know what, how to tackle these changing needs is important, but it's definitely a challenge.
Any other questions?
Another word that's coming up for me is grief. And so I'm wondering like how that's like talked about in the study, and then how is then the grief metabolized to continue sustaining the work and contributing to the resiliency?
How do you mean, the
Like-
grief from just
Grief
how
in general
things are?
from different areas of life.
I think it's also, I'm not sure if we reflect on that too much on the study, but I can speak from just the personal experience and the organization that I work with. Grief is definitely a part of the work, just because of sometimes losing teammates, losing the organization I work with provides services to people who have been deported, who have substance use disorders, especially opiates, and with the, with everything that's happened in the last few years in that area, we lose people all the time, including people who had been staffed and passed away. And incorporating that into the work is also important. We do a Dia de Muertos celebration for all of them every year, and that becomes part of the culture of what we do, having a space for the community to come, grieve, talk about them, celebrate their life, and also have that opportunity where we get a lot of people to do workshops, trainings, provide services, invite other people to come in and get to know the work. Like I said, you capitalize on sometimes, and I know that sounds awful, but for lack of a better word, you make use of even things like.
Just I'm reflecting on this and the point about grief made me think about, I hadn't thought about this article in a long time. I feel badly because the author's an old friend of mine. But Mike Edwards, who wrote a ton on civil society over decades, sort of changed and started working on a journal called Transformation, which wrote a lot about the balance between doing justice work but not burning out. And he had this one essay, The Love That Does Justice, and his argument was love by itself can become an empty sentiment, but working for justice without love and compassion tends to make you bitter, angry, and a destructive person. And I think one of the things that this just generates in my mind for all of us is how do we continually try and work toward that balance? Because on the one hand, we were talking about, what is peace building and do you notice structural violence? We can get angry, and it's a righteous anger, like a Hosea or an Amos in the Old Testament who's just infuriated by that. But if only you have anger, you have no, in the end, friendships, relationships, because you just, you're like, oh, what's the character in and Out, the Lewis Black character who's red. Well, you need other things with that. And so I think, following this, I think this is a really interesting example of how do organizations, individuals constantly balance those two sides. So that's my reflection on this. You don't have to answer. It's not a question.
Well, it's a really, I think it's something really important to reflect upon it and to kind of witness or see how the people who have worked in these organizations also just, have their own backstory, have their own issues. Like I said, burnout was particularly bad during this time, not only because they were exposed to terrible things, but because, they're human and they're going through their own things. It's also common for a lot of the people who are working in these organizations that these are things that are close to home or that they can empathize on a more personal level. So balancing that is also really important, having teammates or people you work with that understand that and what you might go through. But it's also curious that I think people who do this work, it's not that vicarious trauma is not an issue or a thing, but taking action or doing something tends to, relieve some of that suffering, even if it's at a small level. I think one of the good lessons from all of this is also knowing your limits and realizing what you can do and do it really well instead of trying to do too much. And I think being able to partner and collaborate well it is what's the best next step to do then. But for each organization and each individual working in that organization, having clear boundaries of what they can do and do it really well at a smaller scale goes, further than trying to do too much.